Hi there, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. You know, a lot of people, when they're getting consultations, will ask our providers, do you use cryopreserved stem cells? And they automatically assume that a cryopreserved stem cell, meaning frozen, is much less effective than a fresh stem cell. Now, R3 Stem Cell has clinics in 7 different countries. Some use fresh stem cells right out of the lab, and others we do use cryopreserved stem cells. And there are several reasons for this. One is it makes transport of the stem cells possible. We transport them on dry ice around the world. Dry ice is at -80 degrees Celsius, which keeps cryopreserved stem cells viable just fine. Now, a second reason we use cryopreserved stem cells is that we know that cryopreserved stem cells, when done right, are just as effective as fresh stem cells. There was a recent study in the Journal of Cell Transplantation this year which looked at exactly whether or not this was true. And here's what they did. They looked at cryopreserved stem cells versus non-cryopreserved stem cells, and they looked at viability, meaning how many survived during the test. 2 is the shape. They call it the morphometry of the stem cells. Do they look like what mesenchymal stem cells should look like? Then they looked at, do they have these surface markers that are indicative of live and active mesenchymal stem cells? And lastly, they tested the stem cells to see whether or not they were able to differentiate down the 3 pathways that indicate that they are very active, viable, potent stem cells. All right? Here's what they found. The stem cells that were cryopreserved had a little bit less viability than the non-cryopreserved. And in that study, it was 95% viability with the non-cryopreserved and 90% viability with the cryopreserved. So there was 5 points difference, 95 versus 90%. Now with us, it's actually higher, meaning with non-cryopreserved, we're at about 99% viability, and with cryopreserve we're around 93, 94%. There is a difference. Is it significant? Yes, but not that much. We actually include more stem cells for folks to make up for that loss of viability. All right? Now, when it comes down to the morphometry, the shape of the stem cells, mesenchymal stem cells, they have a very noticeable spindle-like appearance. That appearance is completely unchanged if a stem cell is properly cryopreserved versus whether it's fresh, all right? The next thing is, does it have these surface markers that are indicative of mesenchymal stem cells? And the answer is there's no difference between fresh versus cryopreserved. And the next variable was, are the mesenchymal stem cells that are cryopreserved able to go down the 3 different pathways that are indicative of active, potent mesenchymal stem cells, meaning adipogenesis, chondrogenesis, and osteogenesis? And the answer is absolutely. Yes, there was no difference between the cryopreserved versus the fresh. So what does all this mean? Is that there is no significant difference except in the viability, like I just mentioned, differences between cryopreserved versus non-cryopreserved. Now, you can't just take a vial of stem cells and throw it into a cryogenic freezer at either -80 degrees Celsius or liquid nitrogen of -190 degrees Celsius. That's not the way it works. If you do it like that, it's going to kill all the cells. All right? You have to use a cryopreservative. So industry standard is maybe 5 to 10% DMSO, which has sulfa in it, that's what the S stands for, or glycerol. So there are ways of not using sulfa as cryopreservative, all right? And we do it both ways depending on which lab and which batch we're working on. Nevertheless, we use industry standard methods of cryopreservation so that our stem cells have the highest amount of viability and all of the characteristics of active, pure, and potent mesenchymal stem cells. The shape, the surface markers, the trilineage differentiation. So scientifically, our stem cells are extremely effective for patients based on how strict we are at the lab with production, cryopreservation, testing for safety. Now, R3 Stem Cell has clinics in 7 countries. So visit us online to see what the closest one is to you. And we offer free consultations to anyone who wants one to see if you or a loved one is a candidate. All right? Our pricing is very, very affordable. We do more stem cell therapies than anyone in the world. All right, thanks for watching.